Hi everyone, and in this video I'll be discussing about histamine and antihistamine. So before I begin this histamine and antihistamine, let us understand what you mean by autocoids. Now autocoids, the name of autocoids is local hormones. So let me tell you what you understand by the meaning of autocoids. Autocoids. Now it is split like this. Autos meaning it is self. The meaning of autos means self, and alkos, the meaning of that is remedy. So it's a self remedy. Now these autocoids are nothing but they are also called by a name called local hormones. Why do they call them as local hormones? You know that actually what happens in hormones, they are synthesized somewhere and they act somewhere. But local hormones are synthesized locally and they will act locally. So that's the reason they are called as autocoids. Now in autocoids, there are three important derivation. Number one, the autocoids derived from amine. So they are called as amine derived. So can you take a guess what are the amine derived? Yes, obviously it is what we are discussing, histamine. So the histamine and one more is serotonin. What is the other name for serotonin? It is also called as 5-hydroxytryptamine. Then we have the lipid derived. We have the lipid derived autocoids. What are those? They are nothing but the prostaglandins, then leukotrienes, then we have platelet activating factors. So these are lipid derivatives: prostaglandins, leukotrienes, and platelet activating factors. Number three, we have peptides. So we have peptides. What are the peptides we have? The peptides what we have is bradykinin. So it is called bradykinin, and we have one more called calidin and one more angiotensin. So even interleukins, cytokines, they come under autocoids, but mainly we will be concentrating on the future videos regarding the histamine, serotonin, prostaglandin concept mainly. So in this topic, what I am going to discuss is the concept of histamine and antihistamines. So let us begin that. Talking about histamine, histamine as we all know is a inflammatory mediator. Histamine acts through three receptors mainly. Let me write the three receptors here. It is called the H1. Then we have the receptor called H2. And then we have a receptor called H3. So sometimes they can ask you which type of G protein coupled receptor are they. Now please remember, this is GQ coupled receptor, this is GS, and this is GI. In simple words, you can remember by the mnemonic QSI. So H1 is Q, H2 is S, and H3 is I receptor. Now what is the role of histamine, that is H1? And you know that H1 is an inflammatory mediator. It's an inflammatory mediator. So what does it do? If it is an inflammatory mediator, what does histamine do? It causes vasodilation, we all know it. Second, it can cause bronchoconstriction. And also we see the triple response. So the Lewis triple response you have studied in pathology, that is the red spot, the wheal and flare. And also in CNS, this H1 is responsible for wakefulness. So patient will be wakeful and histamine is responsible for wakefulness. Now GS is present mainly in the parietal cells. And what is the role of this in parietal cell? Can you take a guess? What is the role of GS in parietal cell? Obviously to increase HCl secretion. So it will increase the HCl secretion in the stomach, that is H2. Now GA coupled receptor, that is H3, is a presynaptic receptor. So it's a presynaptic receptor. Now let me tell you about the histamine, and then I will come with the blockers later. Do we have any drug which stimulates histamine? Yes, we have a drug. What is the name of it? The drug which stimulates histamine receptor is a drug by the name beta histidine. The name of the drug is beta histidine. So what is the specialty of this? It's a H1 agonist. So the drug is an histamine agonist. Second, it causes vasodilation in the inner ear. So inner ear, that is vestibular apparatus, it causes vasodilation and it has shown to decrease vertigo. Particularly vertigo is seen in which disease? In Meniere's disease. So in Meniere's disease, the drug is known to decrease vertigo. How does it work? H1 action, vasodilation, and decreases the vertigo. Now remember, it is contraindicated in a patient with bronchial asthma. Now, can you tell me why it is contraindicated in a bronchial asthma patient? It's a histamine agonist, obviously will cause bronchoconstriction. So where do you use it? It is used the treatment of vertigo. So this is the only therapeutic use of the histamine agonist, that is called beta histidine. Now if you remember, I was telling you one more thing, that is there is a H3 receptor. And I told you H3 receptor is present presynaptically. That means if I write a synapse, now this synapse, what I am writing is in the CNS. So this is the synapse. This is the one. Now I told you histamine, particularly the H1, is responsible for increasing wakefulness. So person will be alert. So because of histamine action in the brain. Okay, we all know that. Now H3 is located here, that is presynaptic. And I told you it's a GI coupled receptor. Now what happens when you stimulate H3? The role of H3 is to decrease histamine release. It decreases histamine release. Yes. So that is the role of histamine. Compare that with alpha 2. What does alpha 2 does? It also decreases normal release. Similarly, this H3 decreases histamine release, particularly in CNS. Taking this concept, what the scientists did is they discovered a drug which can block this H3 receptor. So we came with a drug called a H3 inverse agonist. It is called as inverse agonist or an antagonist. So a drug which is an inverse agonist or antagonist for H3, the name is called pitolisant. The name is called pitolisant. It is also called by one more name, piprolisant. So let me repeat the name, pitolisant, or also called as piprolisant. So what happens when I use the drug? When I use the drug, let me take one more concept for you, same diagram here. When I use the drug, which is a H3 inverse agonist, now this is a place where H3 is blocked. Or what is the inverse agonist? Which produces opposite action. You tell me, when I stimulate H3, what was happening? Histamine release was decreased. When I have inverse agonist, what happens? There is increase in histamine release. Where? In the brain. Increase in histamine release, and that histamine will act on H1 in the brain and increases wakefulness. So it increases wakefulness. So patient will be alert. So the use of this drug, what is called as the pitolisant and piprolisant, where do you want the person to be awake? There is a condition called narcolepsy. A condition called narcolepsy. You know what is narcolepsy? It's a daytime sleepiness. So patient will be asleep in the daytime also. And for that patient, we use this drug, pitolisant or piprolisant. What is the mechanism of action? It's a H3 antagonist or inverse agonist. Now, can we take a guess what is the other drug which can be used for narcolepsy? We discussed in symbolic system, and that is called modafinil. So we have covered two drugs, beta histidine, and we have covered pitolisant. Now, coming to the concept called antihistamines. The concept called antihistamines. Basically, when I tell about antihistamines, they are nothing but they are H1 blockers. So antihistamines basically mean they are H1 blocker. Now where to use H2 blockers? H2 blockers, I will give an example for H2 blockers, and most of you know the example for that. Can you tell me that? Example is ranitidine, cimetidine, famotidine. So they are used to treat the peptic ulcer disease. So H2 blockers are discussed extensively in GIT topic. So here what I am going to discuss is the antihistamine, that is H1 blockers. Now let me tell you the antihistamines here. Antihistamines. Basically when I talk about antihistamines, there are two generations. The first generation and then the second generation antihistamines. So basically we have two different generation of antihistamines, the first and second. What is the difference between first and second generation? Now the first generation, they cross the blood-brain barrier. Now what happens if they cross blood-brain barrier? They will enter the brain. Let them enter the brain. But when they enter the brain, they block the histamine in the brain. What happens if you block histamine in the brain? I told you histamine is required for alertness, wakefulness. So if you block that, patient will have sedation as the adverse effect. So patient will have sedation. Second generation, they don't cross blood-brain barrier. So what is the advantage? The advantage is patient will not have sedation, no sedation. So since they don't produce sedation, which patient should we prefer this? Patient would require alertness. For example, a truck driver who has to be attentive throughout his work, they require this. For them, if you give first generation, they will sleep away. Now moving on to the next one. These first generation have one more property that is called anticholinergic property. They have anticholinergic property. Do second generation have that? No, they don't have this anticholinergic property. Number 3, these second generations have additional anti-allergic mechanisms. So they have additional anti-allergy property. So there's a difference, basic difference between first and second generation antihistamine. So I will go one by one. First I will discuss first and then I will go to the second generation. So let us go. First generation antihistamine. So when I talk like this, the drugs which come to the mind are diphenhydramine. So please make it a point to remember the drugs diphenhydramine. One more drug is called dimenhydrinate. So that is hydramine and this is hydrinate. Dimen. Then we have a drug called promethazine. The name of the drug is promethazine. Now these drugs have high anticholinergic property. All the first generation have, but these have high anticholinergic property. High anticholinergic property. Now what is the advantage? Where should I use it? These are used whenever we require anticholinergic effect. Where? For example, patient had drug-induced two conditions, acute dystonia. So drug-induced acute dystonia. Where do you see acute drug-induced dystonia? For example, you gave an antiemetic, metoclopramide. So when the antiemetic is given, suddenly neck will turn to one side. So then you can reverse it, and the most commonly used drug antihistamine is promethazine. Many a times in elderly, if you use the drugs such as metoclopramide, they also can develop Parkinson's symptoms. So in these two conditions, the drugs can be used. So drug-induced acute dystonia and Parkinson's syndrome. What is the problem here? Whenever you block D2 in the brain, there is increase in acetylcholine. And that is the reason why the patient develops two important problems, that is acute dystonia and Parkinson's symptoms. So how do I overcome this? I can overcome this by suppressing acetylcholine. Not only that, this drug promethazine is also used for one more condition. What is that? It is used for preventing motion sickness. So it is used to prevent motion sickness. That means the drug has to be taken before the travel. So other antihistamines which are also used to prevent motion sickness, let me write them. They are called meclizine, and one more drug is called buclizine. These are also antihistamines, and their major usage is to prevent motion sickness. Meclizine and buclizine. So basically now we have 5 drugs: diphenhydramine, dimenhydrinate, promethazine, meclizine, and buclizine. Okay. So let me move on to the other drugs in first generation. So what we have is a drug called doxylamine. Now doxylamine is combined with a vitamin called B6. What is the other name for B6? Pyridoxine. Now the combination is the drug of choice for a condition in pregnancy. What is it? So it is called morning sickness. So doxylamine plus pyridoxine is the drug of choice for morning sickness. Morning sickness is a condition where the pregnant woman, particularly first trimester, she will have nausea and vomiting in the first trimester. The other drugs are phenyramine. If you know phenyramine, you just add chlor for that. So what does the drug become? Chlorphenyramine. Phenyramine basically is used to treat allergy, and chlorphenyramine is used in cough and cold medications. For example, cough syrup, dry cough syrup. There we see this. So it is present in cough and cold medications. The other antihistamines is hydroxyzine. Hydroxyzine is one of the commonly used antihistamine by the dermatologist. It is used to treat pruritus. It is used to treat pruritus. So one more drug, doxepin. So doxepin is also used to treat pruritus, but it's a different kind of drug. So it belongs to tricyclic antidepressant. So TCAs, doxepin, has antihistamine property. That's why I have told you here. So it is used to treatment of pruritus, that is itching. So until now what I discussed, these drugs are first generation, and the problem with them is sedation. But the advantage is they have anticholinergic property. They can decrease nasal secretions. So this is the advantage, and we can use it in these conditions. Now, why did the second generation came? The reason why the second generation came is because to avoid the sedation problem. So when the second generation came, I told you they don't cross blood-brain barrier, so no sedation. So in this we have a drug called terfenadine. The name is called terfenadine, and a drug by the name estimazole. And one more drug is Avastin. All these drugs have shown to increase the risk of QT prolongation. So these drugs increase QT prolongation. It's a arrhythmia condition. Now the first 2 drugs are already withdrawn or they are banned from usage. Avastin is still being used because some patient it has caused, still the reports are not yet documented. So that's the reason Avastin is still used, and all the 3 can increase the risk of QT prolongation. Now terfenadine after metabolism will give rise to a drug called fexofenadine. Now terfenadine will give rise to fexofenadine. Fexofenadine and terfenadine, the question is terfenadine a pro-drug? No. Terfenadine is also active, fexofenadine is also active. So the difference between terfenadine is it can cause QT prolongation, but fexofenadine will not produce that. No QT prolongation with fexofenadine. So you can use it. The other second generation antihistamine is cetirizine. So we have cetirizine and levocetirizine. So what is the basic difference between cetirizine and levocetirizine is cetirizine, any drug, because any drug is a chemical, any drug will have 2 isomers. levo and dextroisomer. So levocitrazine is a levoisomer of citrazine. What is the advantage of using a levoisomer is lesser dose. Suppose if you use citrazine 10 milligram, you can use levocitrazine 5 milligram. That is the only advantage. Then we have a drug called loratadine. Loratadine after metabolism will give rise to desloratadine. Now the question asked is this an example of prodrug? No. This is active drug giving rise to active metabolite. Now one more classical example is, hydroxyzine. Hydroxyzine belongs to first generation. After metabolism, it will give rise to citrazine. So again, this is not an example of prodrug. Then other drugs, what we have is a drug by the name rupatadine. Rupatadine has an additional property, that is anti-platelet activating factor property. So that is a specialty of rupatadine. Now, is there any topical antihistamine which we can use it as nasal spray or we can use it as eye drop? Yes, we have topical antihistamines. So they are applied topically and they are all second generation only. So topically applied antihistamines are the drug called azilastin and olopatadine. So these are topically, you can use it as eye drop or you can use it as nasal spray. So they are given topically. So these are the antihistamines what I had to discuss, right? And I told you what are active and what are the product of them. So that is about histamine and antihistamine. So before I conclude this topic, I just want to analyze certain cases here. Now please see the case. First case is a truck driver and he has allergic rhinitis. So will you prefer first generation or second generation antihistamine? So obviously truck driver, so treatment should be the second generation antihistamines. So a pregnant woman has morning sickness. So what is the best treatment for that? The treatment for that is a combination of doxylamine plus pyridoxine, that is a drug of choice. Now moving on to the case number 3, a medical student who has eczema and allergic rhinitis. So here also you can give second generation, and if we also don't want to take a oral tablet, then you can use topical antihistamines. Can you tell me some topical antihistamines? They can be used as nasal spray. Topical antihistamines are azilastin and olopatadine. So they can be used. Patient wants to travel in hilly areas but has motion sickness. So to prevent that, what we can use is promethazine. You can use meclizine or you can use buclizine. So these are the options what we have. A patient had a bee sting. So when a bee stings, histamine is released. So he will have rashes. So treatment is with antihistamine. Anything can be given, but the most commonly used one in our hospital setting is phenyramine. So that can be used as an injection. You can give it IV. So this is the end of histamine and antihistamine. Let me clarify this. Please understand the difference between first and second generation. First will cause sedation. They have anticholinergic property. Second, they don't cross blood-brain barrier, no sedation, and don't have anticholinergic property. And most of the examples I gave you, they are active drug, give rise to active metabolite. Okay, so that is about the first topic in autopsy, that is histamine and antihistamines. Thank you all.